Trump bulldozing U.S. government officials who admitted to poisoning our military as thousands are dying. Water is essential to life, and as Americans, we expect that what we're drinking is safe. While that's the case everywhere around the country, it was not true for our Marine heroes and their families living on base in North Carolina while serving our country. For years, the victims had no clue that the water they were consuming and using on a daily basis was killing them, and now it's too late. The government has admitted their part in poisoning thousands of America's finest and their families for years, many of whom have died before justice could be served. The devastation of those affected is far sweeping and extends beyond having been poisoned. Many rely on the Veterans Affairs for treatment for this horrible illness and aren't getting it. Approximately 900,000 Marine Corps veterans have been poisoned by contaminated water at Marine Corps Base Camp Lejeune. These victims' only hope is in President Donald Trump to be the first president to do something about it, and a VA whistleblower is now being the one to pursue the president in getting the deathly ill veterans the help they deserve. The Atlanta Journal-Constitution reports of what these victims were contaminated with for years while the issue in the water was ignored. The North Carolina base's drinking water contained toxic chemicals from the 1950s to the 1980s. Hundreds of thousands of people, Marines and their family members, were exposed to the water. The Lejeune Community Assistance Panel, administered out of the Centers for Disease Control and Prevention offices, was created 13 years ago to share information and give those poisoned, many who are sick, a forum to be heard. An AJC article on Sunday highlighted complaints about recent efforts designed to help those suffering. Veterans and their families say programs administered through the Department of Veterans Affairs are failing to properly notify those affected and leaving family members behind. Just as the contaminated water issue went unaddressed for decades, so have victims' access to health care and disability benefits from the Department of Veterans Affairs. Those who served at Camp Lejeune from 1953 to 1987 who had been poisoned, have already died waiting for a response and care. However, a suspected 500,000 more affected veterans are still living but believed to have a much higher mortality rate than the general population. Playing a critical part in the death rate is the lack of care they are getting and response to requests for help and answers from the defunct VA system, which has been mismanaged, overwhelmed, and understaffed for years. According to the Washington Examiner, the majority of deceased or living Camp Lejeune veterans and their family members have not received any compensation for the health effects from being exposed to contaminants at Camp Lejeune or for the loss of their children who were miscarried as a result of the toxic water on the base. Less than 20% of family member insurance claims have been approved by VA. The agency has only approved 463 of the 2,519 family member claims filed between 2014 and 2017. VA's decision not to compensate Camp Lejeune veterans for all of the 15 known health effects related to Camp Lejeune is in direct opposition to the findings stated in departmental guidance. Currently, veterans who suffer from critical illnesses like neurobehavioral effects, miscarriages and infertility, and renal toxicity receive no presumptive disability compensation. There is no reason that Camp Lejeune veterans do not receive the same type of disability compensation as veterans exposed to Agent Orange. It's sad and unacceptable that prisoners in our country get better medical care while serving their sentence than our heroes who defended and served our nation. They are being forgotten and ignored after suffering horrific poisoning they should have never been subjected to on an American military base of all places. I strongly encourage the Trump administration to move forward with administrative and legislative reforms to improve veteran access to health care and disability benefits. The White House should resist bending to the will of disloyal false prophets who seek to undermine the presidency by exploiting veterans' concerns about privatization as means of maintaining job security. The president would find that the veteran community, 21+ million strong, will support his administration, if the White House engages them directly and conveys a clear cohesive message about its long-term goals for preserving the VA while expanding access to care for veterans who can't be serviced by a VA medical facility in a timely manner. Something can and should be done about this to save or at least extend the lives of hundreds of thousands affected veterans who need someone to rely on.